taking a break during the pandemic. But neither is treatment for those addictions. Treatment groups say they've had to adjust their operations, whether moving treatment sessions online or handing out masks along with their naloxone supplies. Joining us with more on these adjustments are Lester Munson, a chairman of the board at Hazelden Betty Ford, a nationwide substance abuse rehabilitation nonprofit, and Brandy Wilson, the executive director at the Chicago Recovery Alliance, an organization focused on harm reduction to address the opioid epidemic. Thanks to you both for joining us. Lester, we see you quite a bit on the Week in Review, so it's good to have you talking about this too.
Thank you, Brandy. Thank you, Brandis.
So, Brandy, let's start with you. How has the pandemic changed the operations for you all?
It really made us figure out how to pivot and quickly. We are now seeing people sort of food truck style. So instead of them coming on our van and getting much more in-depth interactions and support, we're having to do things really as though our truck is a food truck, window service and getting things that people need, but also our deliveries have increased. And as other harm reduction programs may have had to scale back or whatever, we have definitely not had a reduction in people that we're seeing. And we have had a greater ask for supplies.
Lester, how about you all? How would you say the pandemic has changed operations?
Almost as soon as the pandemic began, Brandis, we noticed that we lost 25% of our resident patients. We offer healing and hope in both inpatient and outpatient settings. And what has happened is a number of the residential patients decided they would go home and come back after the pandemic. However, our outpatient is now at 100% and growing almost by the day. So we've had a lot of patients coming in, but we're down to 75% of our revenues. So we have had to make some changes in our operations. A very small number of furloughs, some salary percentage reductions, and other things. And right now, everything seems to be falling into place. We expect to come out even when the pandemic finally comes to an end.
And Lester, so for the people who are in the facilities, how are you managing making sure that they don't have COVID-19?
That is the question. Yes. We, before we admit anybody into either inpatient or outpatient, they are examined, taking of temperature, checking of all symptoms. If anybody has any of the COVID-19 symptoms, they are sent away to a hospital or to a doctor. They can come back when they recover. And then all of the vendors, all of the people that are involved in our operation, every time they come onto one of our 17 campuses, their temperature is taken, they are examined. We now have a testing program that we are in partnership with the Mayo Clinic. We are able to do tests that get very quick results. So the combination of the thermometers and the tests and the vigilance has kept us away from COVID-19 on all 17 of our places.
Brandy, you say that, you're actually seeing an increase in the need. How are you also making sure that your staff who are interacting with the folks in need, that everyone is making sure that they are not passing the virus between themselves, if anyone should have it?
Right. So first we split our team in half, and because half of our team are some of the folks that really came up through the HIV epidemic. So they are in more vulnerable groups. So we really divided our team in half, and those folks are playing a big support role, making sure we have everything we need and done in sanitary ways. So because we can't have a lot of people at our warehouse making kits and doing all of the things that it's taken us so much human power to make. Our staff that came off of outreach, they're making sure that we have all of those. And then myself included, the ones of us who are doing outreach, we have created policies along the guidance of CDC and IDPH. We all wear masks.
And Brandy, are you also providing, what can you provide online? You know, if a lot of what you do involves, you know, distributing and training on naloxone and Suboxone, what are you able to do online?
We can do most of that online. So we currently have biweekly overdose prevention train the trainer trainings. And so people can sign up for those and then they can be naloxone trainers in their community. We also are working with the city of Chicago for their homeless COVID shelters. We are weekly doing naloxone trainings for all folks living there. And we are doing the naloxone distribution as well through those. And a lot of those.
Sorry, I just wanted to get to cover as much as we can. Lester, how are you ensuring treatment and access? You said you've got a lot of folks who have gone home. How are you ensuring that they can maintain their sobriety through the online communications that you have with them?
We have moved from one-on-one counseling in person for all of our patients to online counseling. We were very concerned about it when we installed it. We had to finish installing it in a big hurry when the pandemic came along, but now it is working out very well. We've had only a few patients who did not have devices. We took care of that. And now the counseling and the group sessions are doing extremely well online. We also have a follow-up care. We follow the patients for 6 months, some of them up to a year. We have various online programs that were in existence before the pandemic that allow people to be in contact with us, as well as attending their 12-step meetings in AA.
Okay, and well, thank you so much. We'll unfortunately have to leave it there. There's a lot to talk about because there's a lot of work that you all are doing, I'm sure. My thanks to Lester Munson and Brandy Wilson. Thank you both for joining us on Chicago Tonight.
Thank you, Brandis.